Hey everybody, good afternoon. It's Brigadier General Dan Tulley here with your Team Udeid update for Friday, April 3rd. We'll get started right off with our first question from Senior Airman Ricardo Dominguez. When we eventually get our first confirmed cases on base, how do you plan on telling the base population that COVID-19 has arrived? So we'll do that through the commanders. We have 2 meetings a day where we synchronize all the leadership team. The commanders will get the word out to the population. But I've got to ask you to maintain good operational security. We've probably all heard about the Theodore Roosevelt out in the Pacific. If we do develop cases on base, we just want to keep that information in the right channels and not advertise that. We have no cases on base as of today, so it's not a problem yet. Next part of your question was, who's going to decide who is essential and non-essential? Your commanders will. Will it be plausible to believe work schedules will be changed around to help encourage social distancing? Again, that's entirely up to your commander. Commanders are empowered to do whatever they need to meet our 3 priorities: protect the force, prevent the spread, ensure mission accomplishment. Great question. All right, our next question is from Captain Andrew Marshall about the Education Center. What prompted the decision to halt DSST, CLEP, and Pearson VUE testing at the Udeid Air Base Education Center? You know, it's a great question. So if I could offer a little perspective, we're probably all tracking the number of colleges, universities, and schools that have closed down around the world. So we're not alone in this. Lots of stuff has been shut down. Really appreciate that people are trying to go after their education in their spare time here at Udeid. Our measures were driven by the requirements for social distancing and protecting the health of the force. Also, the small sizes of the classrooms in the Education Center made that a real challenge. But I will tell you that the team and the Force Support Squadron is working hard to try and get back to a new normal. So all of our services, as soon as we're able to, once we have the data that we need on the spread of the virus, and we're confident we've got it under control here, how do we get to a new normal where we maybe maintain social distancing measures, and then we open up things like testing and some of the other services we offer around the base? Great question. All right, so the next question is from Senior Master Sergeant Rose Wingate regarding alcohol sales. Has there been any thought given to allowing SLAR-type sales where members can take their 2 or 3 drinks back to their rooms for consumption? So our focus is on the AFCENT guidance, cease non-essential gatherings. That's why we ended up having to shut down alcohol sales, because the social gatherings were continuing despite that. So social distancing is the issue we're trying to avoid. And then when it comes to maintaining good order and discipline, our alcohol policy that's been in effect here for probably the better part of a decade or almost 2 decades now, we don't allow folks to take alcohol back to their room for a variety of reasons. All right, next question about volunteering at the Med Group from Staff Sergeant Barry from the 379th ELRS. So our Med Group is entertaining volunteers. They do need some help with different things. They won't employ you for medical reasons. They've got plenty of staff who are qualified on the technical aspects of what they do, but they are looking for volunteers for other things. And what we're going to do is, in the frequently asked questions, we're going to put out the single point of contact for all the volunteers. We've had so many of them, and thanks for what you guys are offering to do to help out the wing and the base. Next question, Tech Sergeant Dorsey and Staff Sergeant Douglas Mitchell both asked about reopening the pools. The BPC pool is open for business. The Coalition Compound pool is closed because of the AFCENT guidance to cease non-essential gatherings. And there were also some issues with the CC pool and being able to clean all the chairs and the plastic tables and stuff that are out there. But the BPC pool should be open today. Next question is about the Defect Hours from Captain Alexander Daniels. If DFACs, which have standard hours that are not 24/7, could open slightly sooner, just outside of the normal lunch and dinner rush hours, maybe open at 10:30 and 16:30 instead of 1100 and 1700. Then could it help prevent the lines which occur every day? You know, that's a good idea. I talked to Lieutenant Colonel Brazel, the Force Support Squadron Commander. He's going to look at that. They're also looking at a host of other measures because the DFACs are one place that we're having a hard time controlling the social distancing requirements. So we've got to feed everybody. They're mission essential, but they're looking at different creative ways that we can try and keep social distancing in place, minimize the spread. All right, one final question from Chief Master Sergeant Tim Moorhead from the 379th Comm Squadron. Can we look at providing a personnel gate in the fence? And I think you're talking about over by where the Magic Makers Comm Squadron are and the BPC compound. We are unable to open up any additional gates. We'd have to put security forces there and provide security for that gate. And we're trying to also funnel traffic through the few gates we have open just to maintain control and if we need to, prevent the spread. So thanks, Chief. Great idea. Unfortunately, we can't do that one. All right. Thanks, everybody, for all that you're doing. Remember, it's all about protecting the force, preventing the spread, and ensuring mission accomplishment. So thank you guys for your patience, for what you're doing every day.